Hi everyone. Today we're going to talk about female urinary catheterization, and Harry and I are going to work together to go through the steps so that you can understand the process that you will need to do in order to perform this procedure.
I'm here to help you.
All right. What do I do?
All right. Well, the first thing we need to do is identify our patient.
Well, the order said that we needed to put in a permanent indwelling catheter for Mrs. Jones, and this is Mrs. Jones. Hi, Mrs. Jones.
Hi, Mrs. Jones.
My name's Melissa. I'm the nurse that's taking care of you today. I just need to check your ID band. Yeah, it's Mrs. Barbara Jones. What's your date of birth? That's correct. 5/20/54. Excellent.
Okay. The next thing we need to do is ask Mrs. Jones if she has any allergies.
Mrs. Jones, do you have any allergies to any medications or anything? How about an allergy to betadine or iodine or latex? None of them? Okay, great.
All right, we got to tell Mrs. Jones what we're doing.
So Mrs. Jones, it looks like you're having a hard time getting rid of all the urine out of your bladder. And so the doctor wants to see how much you still have in there. And to be on the safe side, he wants to put a catheter in and leave it in so that we can monitor your output more closely. Do you understand that? Good. So it's going to be a little uncomfortable. I'm going to clean you off down there and do the procedure and put the catheter in, but I will try and make it as quick and painless as possible.
Okay, and we would have reviewed the chart for any kind of limitations as far as the flexibility of Mrs. Jones's lower extremities, since we have to manipulate them.
No, she is very mobile.
Okay, well in that case, let's bring the catheter kit and any other necessary equipment to the bedside, and we'll perform hand hygiene because we're starting a procedure.
Do that again, sure. A little Purell.
All right, we'll give Mrs. Jones as much privacy as we can. We'll close the curtains or the door.
Great, if you could close the curtain behind you. I already have the curtain closed on this side.
All right, fantastic. Do you have enough light?
I do. The overhead lighting looks pretty good, but if I need it, I'll let you bring in a flashlight and maybe you can help me if I'm having a hard time finding the right spot.
Okay, awesome. Is this bed in a comfortable position for you?
It is. I'm going to lift it up just a little bit to be more my height so I'm not bending over and saving my back. And Mrs. Jones, I'm going to flatten you out a little bit so that I get better exposure of where I need to be. Are you comfortable? Great.
All right, so Mrs. Jones is flat on her back, and recommendations are that if you are right-handed, you're on Mrs. Jones's right side, and if you are left-handed, you'd be on this side, on Mrs. Jones's left side.
This is my side.
Okay, fantastic. Well, let's put on some just clean gloves, not sterile ones,
Sure.
and get Mrs. Jones into position.
All right, we can do that. All right, Mrs. Jones, I'm sorry, but I'm going to have to expose your parts down here so I can get at them. You're going to be a little cool for a second, but I promise to get a nice warm blanket afterwards and warm you up. All right, great. And I'm going to position your legs so that I can get at this very easy. All right, are you comfortable in this position? This isn't a problem? That's good. I can see with my clean gloves that I know exactly where I need to go.
Fantastic.
And this should be pretty simple. She seems to be holding the position very well.
All right, great. So with soap and water, we take a washcloth and we just clean downtown there. Make sure that that's all done, and then we're going to get rid of those gloves and put on new gloves if we wish, and otherwise we're going to open our sterile kit.
Fabulous. She's all cleaned up and washed up.
Okay.
That's all been done. So I have my sterile kit. I'm going to rip it open, and I'm going to pull out. I'm going to get rid of this in the trash. And I have my sterile field here that I'm going to open up slowly by pulling the corners away from me on the underside and positioning.
All right, now don't forget you have 1 inch around the entire border that's considered contaminated or dirty.
I won't put anything on the outer 1 inch.
All right, perfect. Now, the first thing that you have in there is a drape that goes under Mrs. Jones. So we're going to ask her to lift up her buttocks, and we're going to open that up and put that right under her.
I'm going to hold the corners to minimize exposing the area. And I'm going to ask Mrs. Jones to lift. Mrs. Jones, can you just lift up for a second? Perfect. And I will straighten out the corners on the outer 1 inch.
Okay. If we had a system that had a separate drainage bag, we would attach the drainage bag to the bed now so it would be ready for us later. But our system's all one, so we'll
Yes,
get
the
that
catheter is
later.
already attached to the drainage bag.
Okay, fantastic. Let's go through the rest of the stuff in the kit.
I have sterile gloves here, which means that's the next thing I have to put on because everything after that has to be sterile.
Right, don't touch that without the gloves.
Okay, so I'm going to put the gloves on now. I'm going to take the sides, open it up, and there's 2 gloves there. I'm going to take the cuff of the first one and slide my hand in. Try and get all the fingers in the right spot, which is hard to do past the ring, but as long as I'm touching the outer cuff. Then I'm going to take 2 fingers and slide under this cuff and put the rest on, and then I can adjust them.
Okay.
All right.
Now, the next thing in there is a fenestrated drape, and that would go over the labial area, exposing the labia.
Just like so.
Do you usually use those?
I never use that.
I find it gets in my way.
I find that if the patient shifts or moves in the slightest bit, that drape drops down and blocks my view of where I need to be.
Okay, it's kind of a personal preference.
So it's still sterile, but away it goes.
Okay. So now we have to find out what else we have in the kit and test all of our supplies.
Okay, so all of this is sterile and I have my sterile gloves on. So I have the povidone iodine solution, which I will tear off a corner and pour onto my cotton balls.
Okay.
I just did that. I'm going to put that to the side. Then I have my lubricant jelly
Okay.
to lubricate up the catheter so that it'll slide into the urethra with no problem.
Okay.
So I'm going to take the cap off and I'm going to put a little bit of that jelly into the tray. And then I'm going to put that to the side. And then I have my pre-filled sterile saline syringe. And this is going to be what I use to blow up the balloon. But I want to test the balloon first.
Perfect.
So I'm going to move my kit, not getting it to the outer 1-inch edge, and take the tray off, putting it right here. And in here I see I have my sterile catheter connected to my drainage bag.
Okay.
I am going to connect the saline to the balloon and test it out and blow it up. And let's see. If we had good supplies, this would work well. And yes, there we go.
Awesome.
All right, it's blowing up. So I'm going to leave that connected so that it's ready to go.
Okay. Balloon's deflated now, right?
Balloon is completely deflated so that it can insert correctly.
Awesome. Okay. So now I think the easiest thing might be to move your supplies closer to Mrs. Jones.
I agree. So I am going to put the tray that I'm going to clean her off on right onto the sterile field, right next to her. And then I'm going to put the box that's all sterile inside right next to that onto the sterile field as best as possible so that nothing is touching Mrs. Jones.
Okay. Fantastic. So now the catheter is lubed or not lubed yet?
It's not lubed yet. I need to do that.
Okay.
So I am going to take the protective sterile glue sheath off and slowly curl it up in my hand so it doesn't touch Mrs. Jones or anything else, right? Only the sterile field. And I can get rid of the glue right there. Go away. And I'm going to put it into the lubrication that I put into the tray. So now it's nice and lubricated, ready to go.
All right. Perfect. It looks like we have our supplies in order. So now, Melissa, you need to decide a dominant hand and a non-dominant hand.
This is going to be my dominant hand. This is going to be my hand that I touch the patient with so that I can maneuver.
All right. Sounds good. Time to clean up Mrs. Jones with some cool solution of iodine betadine.
Okay, Mrs. Jones, it's going to be a little cold and wet for a second.
So, Melissa, if you take the cotton ball with your non-dominant hand, open up her labial area, use that one cotton ball to wipe from top to bottom on one side.
Okay,
And then we'll toss
I wiped
that
to the
ball.
right, and I got rid of the cotton ball onto the sterile field.
All right. New cotton ball.
New cotton ball, I wiped from top to bottom on the left, and got rid of the cotton ball.
All right. Perfect.
And then final cotton ball, I'm going to go right down the middle, cleaning off the meatus all the way straight to the back, and then get rid of that and the little forceps.
All right. Fantastic. Now, using your dominant hand, we're going to pick up the catheter.
Okay, I'm going to pick up the catheter by coiling it up in my hand, and it's already got the lubrication on it.
Fantastic. We're going to advance the catheter into the urethra until there is return of urine, which is approximately 2 to 3 inches.
Okay, it's going in. Mrs. Jones, a little bit of pressure.
Deep breath.
All right, I'm sliding in, not meeting any resistance. And oh, I'm already starting to see yellow liquid coming into the tube.
Fantastic.
Looks like urine to me.
Once urine drains, we're going to advance the catheter another 2 to 3 inches, but we're not going to force it through the urethra into the bladder.
I usually advance it 2 to 3 inches, and on a male patient, if I can advance all the way to the Y connection, I usually do, as long as there's no resistance and they can tolerate it, so that way I know I'm not at the bladder outlet when I go to inflate the balloon.
Okay, now hold the catheter with the non-dominant hand and inflate the balloon with your dominant hand. Inject the entire volume of that pre-filled syringe into the balloon.
Okay, that is done.
All right, fantastic. Now give the catheter itself a gentle pull, just to make sure that you have it in good placement.
Yeah.
Fantastic.
And it's not coming out.
All right. So now we have different devices that we can use to attach this catheter to Mrs. Jones's leg, and then after that we'll attach the drainage bag to a non-moving part of the bed.
Perfect. In my hospital, we have a special tape device that tapes to the leg and then velcros over the tube to hold it in place right here at the Y, so that if she moves her leg in any direction, it's pulling on the leg first, so it's not pulling on the meatus and causing trauma.
Perfect.
So I will use that, and then I will hook up the bag so it is below the level of the bladder for gravity to drain it, and not to reflux back into the bladder and cause infection or issue, and I'm going to hang it on the bed on a non-moving part of the bed.
Perfect. The last thing we need to do is get some more soap and water and clean up that iodine in Mrs. Jones, cover her back up, and make a documentation of what we've done.
Perfect.
All right, thanks,
I will
Melissa.
do that. I'm going to go change my gloves so we can clean her up.
Sounds good.
Okay, Mrs. Jones, we're almost finished.